Coronavirus found in Hong Kong pet dog sample. Hong Kong authorities said they will conduct further tests to confirm if a dog has been infected with coronavirus. Hong Kong authorities say they have quarantined a pet dog of a coronavirus patient after its nasal and oral samples tested weak positive for the virus, though they added they did not yet have evidence that it can be transmitted to pets. The dog did not have any symptoms. The Agriculture, Fisheries, and Conservation Department, AFCD, said it would conduct further tests to confirm if the dog had been infected with the virus or if the samples were the result of environmental contamination. In other words, the dog was in the apartment with the lady. Whoops. We love our fur babies. At present, the AFCD does not have any evidence that pet animals can be infected or can be a source of infection to people, it said in a statement. The dog will be put under quarantine for 2 weeks. The World Health Organization website says so far there has been no evidence that companion pets can be infected with the coronavirus. Several users on Chinese social media, Weibo, called for people not to spread reports that could lead to pets being harmed for fear of infection. So let's not get carried away. This is pretty irresponsible piece of news, said one user. It is very likely it could bring disaster to many pet dogs and cats on the Chinese mainland. Hong Kong has reported 94 confirmed cases of coronavirus infections in humans and 2 fatalities. Aged homes warned to prepare for outbreak. Confirmed cases of coronavirus in Australia rises to 25. 2 more coronavirus cases have been confirmed in Australia, but while COVID-19 continues to spread, the WHO has yet to declare a pandemic. I think the WHO is more concerned about economic viability of the world than they are about the world's health. The number of confirmed coronavirus cases in Australia has increased by 2 to 25 as the World Health Organization raised the risk of the spread of the disease to very high. A 63-year-old woman who was recently returned from Iran is in isolation at the Gold Coast University Hospital, while a 79-year-old West Australian woman has tested positive after being evacuated from the Diamond Princess cruise ship in Japan. According to the Australian Health Department, there are 84,117 cases worldwide and 2,872 reported deaths. I wish we could get a set of consistent numbers. It seems to keep jumping around. World Health Organization raises coronavirus risks to very high. The continuing increase of the number of cases and number of affected countries over the last few days are clearly a concern, to WHO chief is said in Geneva. He said that 24 COVID-19 cases have been exported from Italy. The worst hit country in Europe, to 14 countries, and that 97 cases have been exported to Iran to 11 countries. From Iran to 11 countries. Well, why aren't we using the word spread? The words that they're using sounds like it's a product. Exported. The UN Health Agency had previously labeled the global risk as high, but still short of calling it a pandemic. The Australian government is already putting in place plans to tackle a pandemic. In particular, it is looking at how aged care facilities can be locked down in the case of a corona outbreak. Prime Minister Scott Morrison said while some countries, such as Japan, are looking at closing schools, there is no need to do that in Australia based on current medical advice. If they're listening to the WHO. Ooh. However, the virus known as COVID-19 affects the elderly more. You know, doesn't this worry you that people are like, well, we don't really need to do anything. It's not really a problem. 25 people, that's nothing. It must have started with 25 people in Wuhan, China, and they didn't do anything. They did not respond. They did not quarantine. They did not close the schools. They did not stop work until it was a disaster. Oh my gosh, do we have to make all the same mistakes as they made? Hong Kong pets face coronavirus quarantine after dog tests positive. Okay, we saw that. Okay, continue the Australian elderly care. The bigger impact would be in things like aged care facilities, the ability to lock those down and to have the right care and support to those who are working in those places, said Morrison on Friday. Health ministers who met in Melbourne on Friday agreed the Commonwealth would take the lead on an aged care advanced planning process. Those who are elderly or those who have difficulties with their immune system are most at risk, and that is why they are absolute priority, Federal Health Minister Greg Hunt said. There he is. No, that's Chief Medical Officer Brendan Murphy. Aged care providers received a letter this week from Chief Medical Officer Brendan Murphy outlining the need for them to have emergency plans in place. While the number of cases of COVID-19 is currently small in Australia, it is possible that this situation could change and services need to plan and be prepared for this, he wrote. Federal opposition frontbencher Jason Clare said, the government is doing the right thing even though the WHO has yet to declare a pandemic. We should be preparing for a pandemic because it is a pandemic. Even by WHO's own website, it's a pandemic. They just haven't said it. I think they're afraid of disrupting the market or, scaring somebody. They have followed the advice of the chief medical officer. They have followed the advice of experts, Mr. Clare told ABC television on Saturday. More coronavirus news. It's just breaking out everywhere, guys. Iceland confirms first case of COVID-19. Friday, February 28th, confirmed the new coronavirus had reached the subarctic island after a man in his 40s who had recently returned from a trip to northern Italy tested positive for COVID-19. People, let me implore you to please, if you have tickets to fly to another country and then back to America, can you make it one way? I know that was really rude, but ugh. Can we just stop traveling? Can we just stop, dragging this thing around the world? White House media stoking virus fears to take down Trump. Well, they've done everything else to try to take the man down. Let's see what they can do with this virus. Coronavirus, Iran's death, at least 210, hospital sources say. The tally by BBC Persian is 6 times higher than the health ministry's official death toll of 34. They don't want to tell us. They don't want the world to know that they're suffering. This is so sad. This is so sad that the world can't get along, even in a time of crisis. Coronavirus, Iran's death, at least 210, hospital sources say. At least 210 people in Iran have died as a result of the new coronavirus, disease, sources in the country's health system have told the BBC Persian. Most of the victims are from the capital, Tehran, and the city Qom, where cases of COVID-19 first emerged. The figure is 6 times higher than the official death toll of 34 given by the health ministry earlier on Friday. Ministry spokesman insisted it was being transparent and accused the BBC of spreading lies. It comes after a member of parliament for Qom accused the authorities of a cover-up, and the U.S. expressed concern that they may not be sharing information, much like China did. Russia, another country of that sort, is only reporting 2 cases. We have made offers to the Islamic Republic of Iran to help. U.S. Secretary of State Mike Pompeo told a congressional committee in Washington on Friday. Their health care infrastructure is not robust, and to date, their willingness to share information about what's really going on inside Iran has not been robust. Iranian Foreign Ministry spokesperson dismissed the offer of help. The claim to help Iran confront coronavirus by a country that has imposed expansive pressures on the Iranian nation through its economic terrorism and has even blocked the way for purchase of medical equipment and medicines is ridiculous and a political, psychological game, he said. Growing lack of confidence in authorities. There are fears in Iran that the government, unsure of how to handle the outbreak, is covering up the extent of the spread of the new coronavirus. People, Islam does not believe in washing their hands. Just saying. Now, a total of figures reported by BBC's Persian sources in several hospitals suggest at least 210 people have died across the country as of Thursday night. The highest number of deaths were said to be in Tehran, where a disproportionately high number of officials have reportedly tested positive for COVID-19, including a vice president, a deputy minister, and at least 2 prime ministers. Friday prayers in Tehran and 22 other cities were canceled, and schools and universities were closed. Thousands of Iranians have also been stranded inside and outside the country as many flights have been stopped to and from Iran. There have been more than 83,000 cases. Blah, blah, blah. Same story, same numbers, different numbers. It's bad in China, but it's out and it's in the world now. Worldwide, 2,800 deaths since the disease emerged, and that's including China. At midday on Friday, the Iranian Health Ministry reported 8 new deaths related to COVID-19, increasing the official toll to 34. It also said that 143 new cases have been detected, bringing the total to 388. So again, like China, we're not getting the straight truth from Iran. Staying home, restricting travel, reducing movement and interactions, avoiding unnecessary travel, canceling any nationwide gatherings along with observing individual health tips are the only ways to control COVID-19. Later, Health Minister Saeed Namaki announced that all schools would be closed for at least 3 days from Saturday as a precaution. We have a relatively difficult week ahead. As we see the trend, the main peak of the disease will be in the next week and coming days. So why are you only closing school for 3 days? A member of the Tehran City Council told LLNA news agency that the number of infected patients rose to 10,000 or 15,000, may rise to 10,000 or 15,000 in the coming weeks. The head of the World Health Organization's emergency program, Dr. Michael Ryan, said Thursday that the apparent high mortality rate in Iran indicated its outbreak might be more widespread than realized. A WHO mission is due to arrive in Iran on Sunday or Monday to help. Dr. Ryan said on Friday that its departure has been delayed due to issues getting flights and access to Iran, but that the United Arab Emirates was helping. Some health experts have questioned the actions of the Iranian authorities since the first cases of COVID-19 were reported 9 days ago. President Hassan Rouhani has ruled out placing any cities or areas in quarantine, despite the head of the joint WHO Chinese mission on COVID-19 saying such measures had helped change the course of the outbreak in China. Let's read that again. President Hassan Rouhani has ruled out placing any cities or areas in quarantine, despite the head of the joint WHO Chinese mission on COVID-19 saying such measures had helped change the course of the outbreak in China. There has been concern about the decision not to close Shia Muslim shrine of Hazrat Muslim in Guam, which is visited by millions of pilgrims every year. People are always traveling back and forth on their pilgrimage there in Iran. It's something that they do, and it's ongoing. Some restrictions on access have nevertheless been imposed in recent days. Mr. Namaki told state TV that people would be allowed to visit the shrine once they had been given hand sanitizing gels, health information, and face mask. They must not gather together in groups. Just pray and leave, he said. The shrine's custodian, Ayatollah Mohammed Saeed, has said that it should be kept open as a house for cure and that people should be encouraged to come. Somebody else said something very similar to that. It's just not clicking in my brain right now. Oh, it was who that said, oh, you don't have to wear a mask. Oh, don't worry about stopping travel. That's just not even necessary. Right. Look what happened listening to those guys. Vice President for Women's and Family Affairs and Deputy Health Minister are among several senior officials who have been infected. And Hamshari online website reported that Mr. Ebtikbar Kar, the highest-ranking woman in the Iranian government, had attended a meeting with President Rouhani and a number of ministers shortly before testing positive on Thursday. Iran has been the source of dozens of cases in neighboring countries, including Afghanistan, Bahrain, Iraq, Kuwait, Oman, and Pakistan. If there are cases in Pakistan, Israel will have to close its border with Pakistan. If they don't, then it'll go into Israel as well. And it may be that they have closed their border because they're at war in the Gaza Strip right now. Well, they don't call it exactly war, but it's a tit for tat kind of, you blow me up, I'm going to blow you up too. Sad. Just sad. Has China said enough about the coronavirus genome? This is what they sent out to the countries around the world to try to help figure out how to treat this virus and also if there was a way to create a vaccine. And this is what Moderna, the pharmaceutical company, research company, that has created the first vaccine that's going to the NIAID for approval to begin the human trials. So this is what they're using, and this came from China. And I don't know why, with the cases in America and now over in Italy and Spain and all around the world and even in the United Kingdom, why we haven't created a way to see the genome ourselves. So, has China said enough about the coronavirus genome? Some scientists have raised concerns about the rate at which Chinese authorities are releasing information, but international researchers say that the virus might not be changing that much, and attention should be focused on getting data from all places experiencing outbreaks. This is what I just said. I should be in charge. I'm brilliant. Here's the nasty little booger. What happened here? Oh, man. Sorry, guys. I don't know why this happens. I'll just be plucking along, and then all of a sudden, the next thing I know, I can't even tell where I'm at. There. There's a little bugger that's killing us. There's a little bugger that's making everyone sick. See these little spikes that come out here? These are the part of the virus that hook to the lung, the cells in the lung. So they're trying to figure out a way to block it from connecting or hooking up to the lung cells that would stop the virus that they're supposing. I don't know if that is going to work. Seems like it'd be a better idea to try to find something that would kill it. When China shared the novel coronavirus genome with the World Health Organization in the early weeks of the outbreak, the health agency hailed it as a remarkable achievement. Understanding the virus's genetic sequence is essential for developing accurate diagnoses and vaccines, as well as determining how the virus is changing. But in recent weeks, questions have been raised in various quarters about how well and how quickly China is sharing this information with the wider world. The questions surfaced in public earlier this month with two prominent scientists affiliated with the Chinese Academy of Sciences, Wu Cheng-ai and Pu Muming, leading a call for China's researchers to publish genetic data as soon as possible. I need Marf's little thing that goes, whoa, whoa, whoa. You know? Oh, man. My tongue just won't move like that. And I don't know. In a letter to China's National Science Review Journal, Wu and Pu guessed why there was what they described as a gap in the data, with only older sequences available to researchers as of February 10th. Okay, this is the 28th. That was like 8 days ago. So we have older sequences that we're working with. That's all that's available. We have patients in Italy and Spain and all over the world now, in 46 countries. So it seems to me we should be able to get a copy of that virus that is occurring in all these different people, and that's all those samples should be sent back to the CDC for them to, you know, bring in those retired, all the specialists in pandemics, so that they can look at this information from these viruses from all around the world as it is occurring and see exactly what is happening to the genome. Is it mutating? Is it not mutating? Is it getting stronger? Is it not getting stronger? Is the genome even correct? They warned that holding back data could slow down understanding of changes in the transmission patterns as the virus mutates. So they're expecting it to mutate, and they're not doing anything to double check that themselves, as far as I'm getting from what this article is saying. If we can get virus genome data as quickly as possible, the epidemic situation can be judged more accurately by comparing the differences in the evolutionary dynamics of the current virus and severe acute respiratory syndrome. So they want to compare the COVID-19 to the SARS. And China Daily, quoted Wu, is saying, those questions were compounded by the closure for rectification on January 12th of the Shanghai Public Health Clinical Center Laboratory that published the world's first genome sequence of the coronavirus. The closure came a day after its team published the information. So awfully suspicious, huh? Coronavirus. WHO experts fail to reach consensus on how deadly outbreak should be defined. I don't have a whole lot of faith in WHO. Nevertheless, when it comes to sharing genetic data for global research, international researchers have defended the information coming out of China in the middle of the public health crisis. Yeah, who are these people defending this? The ones that have the potential vaccine? I mean, who is backing up that data? Just, I hate when they don't give you specifics. Like, Italy is scientists in the laboratory, was scientists with X amount of years experience working with viruses. His opinion is that blah, blah, blah. It's all good. No, they don't say that. They just say, well, some people, They said that while it is important to have as much data as possible, it played less of a role in the short term if the virus was not changing, as appears to be the case in China. Because that's the information we're getting from China. Gavin Smith, a professor in the program of emerging infectious diseases at Singapore's Duke NUS Medical School, said there could be an overestimation of the role of the genetic sequence in immediate public health responses to outbreaks. You want to get those first genomes out when something happens, but after that, if there's not a lot of variability, then maybe that's not the priority anymore, Smith said, noting that in the public health crisis, there are higher concerns that could slow down the release of new data. You would think in this day and age, with all the advances that we've made, this would be a piece of cake. Where it is useful is for things like vaccines, diagnosis, and molecular epidemiology. Researchers said that as the crisis appeared to be on the brink of becoming a pandemic, attention now needed to be on keeping an eye out for variations in the virus in different parts of the world rather than just in China. Well, thank you. Given the spread of the virus and the relatively good control that mainland China has right now over the situation, I think it would actually be more important to get a lot of sequence information from Iran and Italy. What did I just say? They really should put me in charge. And the cases seeded from those countries. Florian Kramer, a professor of microbiology at the Icahn School of Medicine at Mount Sinai. There's the numbers. They're growing higher and higher by the day. Australian virologist Ian Mackay agreed. As other countries undergo explosive outbreaks, or we suddenly find outbreaks that may have been percolating unknown for weeks, it is important to take stock of these genomes, he said. But like Smith, Mackay said that so far the genetic change did not appear to be a driving factor in this outbreak. It is important to keep tabs on a newly circulating virus, although so far this one hasn't thrown up concerning novelties in terms of genetic change as it's passed from person to person, he said. Roy Hall, a professor of microbiology at the University of Queensland, said it was important to have information from all places with an outbreak. We still don't know what this virus is going to do. Any pattern in any outbreak cluster that can be correlated with a change in the way the virus is behaving can be very useful, Hall said. Having that information from the earliest cases in China to the most recent human-to-human cases in other countries, epidemiologists can pick up a pattern of change. Seems like they're selling some information there, an ad. Okay, there we go. Come on, stop, rolling, stop. All right, any minute now. I'm going to get back to the start of this article. Coronavirus. Quarantine recommended for pets of Hong Kongers with COVID-19 as Pomeranian tests positive a second time. That was a story we read earlier. But cities' veterinarian surgeons say no evidence yet coronavirus could infect domesticated animals, as there is a high possibility of environmental contamination. Oral and nasal samples taken from the pet dog tested weak positive on Friday, the same result as obtained the previous day. I don't know what kind of little bug that is that I have in my house in the middle of winter. I think it's weird. Just flew on my screen. Hong Kong's Department of Health is strongly recommending that dogs, cats, and other mammals of confirmed COVID-19 patients undergo a 14-day quarantine after a pet Pomeranian of one patient again registered a weak positive for the virus that causes the disease in a second test. Previously, family members were not allowed to care for the pets of the infected if they did not live with the patients and were not subject to quarantine themselves. But from now on, we will ask the owners to send their pets to the Agriculture, Fisheries, and Conservation Department for quarantine just to make sure they are not infected, said Dr. Shong Quan, head of the Communicable Disease Branch of the Center for Health Protection. The Department of Health later clarified that this was not a mandatory requirement, but was unable to say what would be done if a patient refused to surrender their pet, as they had not confronted such a situation yet. I don't know. Would you take your baby home with you, or would you look for someone in your family to care for it if it could possibly have the coronavirus? The move came as the department revealed late on Friday that oral and nasal samples taken from the pet dog tested weak positive earlier in the day. The same result obtained in the test on Thursday. The department said it would continue to do tests on the dog, which would not be returned until the results were negative. I don't know if I could let them take my baby. Chang said a cat belonging to Hong Kong's 18th confirmed patient, a 25-year-old man, had previously been sent to the department for testing. Its results were negative, and the cat, an exotic shorthair, was sent back to its owner, who was discharged from hospital on February 12th. A Shih-Tzu dog belonging to a 68-year-old woman with the virus, meanwhile, tested negative and was being quarantined. The woman, the city's 77th case, was one of those who tested positive after visiting a Buddhist temple in North Point, because they do a lot of touching of those temples. Chang said the health authorities would review the entire list of 94 patients to see if any pets that would need to undergo testing. On the Pomeranian, the department said in a statement in the small hours of Friday that the dog, despite the initial test result, had not shown any symptoms, nor was there any evidence to suggest pets could either contract the coronavirus or be a source of infection. Look at that little baby. Oh, look at that face. At a morning press conference, Secretary for Food and Health Sophia Chan-Xiu-Chi confirmed that the dog would undergo a 14-day quarantine at a department animal keeping facility near the Hong Kong Bridge. The department had conducted the second test to confirm if the dog was really infected with the coronavirus or if the result could be attributed to environmental contamination of its mouth and nose. Well, you know, doggies go around sniffing everything. According to Chong, the dog had had relatively little contact with the outside world. As far as we know, the dog that tested weak positive is quite old and rarely goes out. It's close contacts with only the people that it lives with, who have both already been sent to quarantine, Chong said. Earlier in the day, Hong Kong veterinarian surgeons called for calm after the weak positive case was announced. Dr. Michael Bradley from Stanley Veterinary Center said he thought it was very unlikely that pets, such as dogs and cats, could be infected with the coronavirus, as very few viruses can jump between species, except the one that jumped from the bat to the person in Wuhan, as they say. The story of it being stolen from the Canadian lab now is no more plausible, or it's old news and nobody wants to talk about it. Hey, let's hear our newest theory. There is no need to panic. There is no evidence yet that the virus can infect dogs, cats, or other domestic animals, he said. It's possible. Oh, Marf is on DLive. Oh. Okay, gotta go. Love you guys. See you at Marf's.